Start nodu. So good evening guys. So today we'll discuss one important condition. So in the afternoon we got one patient. So he came with complaining of severe gastritis and some nausea feelings. So in our hospital they have given some pantoprazole injections. One more is there's some antiemetics injection they have given. So immediately after giving an antiemetic injection, patient developed suddenly feeling of stiffness of the hands and the wrist movements. So patient will suddenly unresponsive stage, like patient will be having some staring looks towards one side, and patient is not having jerky movements, but he is having some stiffness of the hand. So after that patient becomes silent. So attendants are so scary, and because of this we explain them, we find the causes. So in routinely, so these things will happen, and if these things happen even after the giving some injections, means you have to suspect some any reactions that cause secondary to any injections and anything. So nothing, we given only 2 injections. One is pantoprazole, one more is antiemetic. So there is no, like, we have to search which drug will cause and some reactions. So today the great concept come here is only the symptoms, like features of extrapyramidal symptom. So there is something called extrapyramidal symptoms. So these symptoms will develop after some injections. So some medications will cause an extrapyramidal symptoms. So what are the medications that causes an extrapyramidal symptoms are? There are some antipsychotic medications and antidepressant medications, and some antiemetic medicines also cause extrapyramidal symptoms. So not all the medicines, not all the drug will definitely cause. Only some drugs, like in case of an like antipsychotic drugs like haloperidol, it will cause an extrapyramidal symptoms. One more is chlorpromazine will cause an extrapyramidal symptoms, and in the same way antidepressant will also cause an extrapyramidal symptom. So only most common one interesting come here is antiemetics that will cause an extrapyramidal symptoms, that should be keep in our mind, because usually in routinely we will give some antiemetics. As a patient complaining of vomiting, we will give antiemetics. So after giving some injection, patient suddenly having some undefinable features like uprolling of the eyes and sudden stiffness of the hand, bradykinesia, ataxia feeling, Parkinsonism like structures. So if all this develops immediately after giving injections, you have to suspect that. So let's discuss one drug that is antiemetic that most commonly we are using is metoclopramide. So that is perinorm injection in the perinorm tablets. So these content, that metoclopramide content, will cause extrapyramidal symptoms. So in this previously video, what you have seen is first girl and second one is boy. So first girl is, she came for the some typhoid fever. So as she is complaining of vomiting, they have given perinorm injection. So it will suddenly after giving injection, she is having some unsteady look. Patient is not conscious. Patient is conscious but not at all oriented. She was having steady look. And second patient is it is a poison patient. As a poison, he is vomiting. We given some metoclopramide injection. After giving injection, he develops a suddenly staring look. So all these things we found that patient is having metoclopramide symptoms. So what are these metoclopramide symptoms? What are these extrapyramidal symptoms? So extrapyramidal symptoms includes, there is something brain structures that will occur extrapyramidal side of the brain. So what you have to do if the patient develops, only thing is nothing to worry. First you have to give assurance to the patient and patient attenders, as they were so scary about this condition. One more thing is, only as sedatives can relieve this everything. So even a simple diazepam injection can relieve the symptoms immediately within a half an hour. So only thing is we have to rule out. So is it any neurological involvement or non-neurological involvement? Is it only a extrapyramidal symptoms or any other neurological symptoms? For this we have to go for the examination. For any extra neurological symptom, like neurological symptoms, we have to examine from the head to toe. We have to examine for the powers, and we have to examine for the mouth deviation and the weakness of the body, and we have to examine for the plantar flexor or extensor, that is Babinski sign. We have to examine. After examining this, have to, if it looks like any neurological symptoms, we have to immediately advise for the CT brain. If the patient is not having all these symptoms, and if you give a history of this, any injections and anything, you have to suspect an extrapyramidal symptoms. So only thing is we have to give some sedatives, and we have to wait for the half an hour, and patient will give normal. So this is a very important, I think, because why it is important is that antipsychotic and antidepressant will if that drugs will cause some these symptoms, means patient attendants will accept that, because our patient is having some psychic issues, so they will accept. But this emetic patients, like vomiting patient, they will not accept this, because after giving injection suddenly patient becomes some unconscious or whatever staring look. So patient attenders think that there may be a great issues after giving injection, so they will think. So please kindly keep in mind that metoclopramide injection may cause, not everything, every time, may cause an extrapyramidal symptoms. If you found any extrapyramidal symptoms, we have to search for any drug history. What are the drugs we have given, we have to select, and we have to see is there any relation towards that, and we have to simultaneously we have to thoroughly examine the patient and do according to it. Thank you.